Thank you, Doctor. Thank you all. And it's now to start the international session. Today is the 1936th day on uninterrupted daily webinar of PH. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1936th day of uninterrupted daily webinar of Ifph. And today's our guest is Dr. MOHIT NANANI, Assistant Professor, LR Shah Homeopathic Medical College, Gandhi Vidyapeeth. Dr. MOHIT NANANI is the founder and lead consultant at Pragna Homeopathy Clinic, Rajkot, Gujarat. Dr. Mohit is a clinical mentor providing hands-on training to BHMS and MD students. He is a former clinical assistant in Dr. Neerav Shah, senior homeopathic practitioner, Rajkot. He was the community health practitioner at Geeta Mandir Charitable Trust Homeopathic Center, Rajkot. He is also a researcher. And today our topic is understanding Lems, Lambert Eaton Myasthenia syndrome beyond pathology, a case demonstrating individualized homeopathic healing. Let us welcome Dr. MOHIT NANANI for the session, and I welcome you all for the session. Doctor? Doctor, you are not audible.
Sir, you are the host. You can make him the co-host, sir.
Yeah, he's already the co-host.
Hello, am I audible right now?
Yeah, now it's okay.
Yeah. So, thank you so much, sir, for introducing me and giving me this opportunity to present and promote homeopathy in this international platform, and also inspiring the youth to practice homeopathy and get aware about homeopathy, and also to inspire and aware the people about taking and knowing about homeopathy, that it can be used in this such deep pathological cases too. Yeah. So this is mainly today's case is about LEMS syndrome. That is Lambert Eaton Myasthenia syndrome, which has been treated with homeopathy, and it has been cured successfully with homeopathic treatment. So let's just begin the case. And I will just want to start my session after remembering my gurus, from which I have learned Dr. Rajan Shankaran sir, Dr. Shekhar Algundi sir, and my guru Dr. Neerav Shah sir, from whom actually I have learned to practice homeopathy and able to solve this type of deep and cross pathological cases too in this young age. So I would like to show my deepest gratitude towards them before starting my session. And as already sir has introduced, that I'm practicing in Rajkot, Gujarat, in Pragna Homeopathic Clinic. It has been named by my mother's name, Pragna Homeopathic Clinic. My mother's name is Miss Pragna. And we'll start with the session of the case, and by introducing what is LEMS first, that it is a type of a neuromuscular disorder. So by definition, it is a rare autoimmune disorders where body's immune system mistakenly attacks the connection points between nerves and muscles. And the core issue in this situation, in this disease, is it is characterized by muscle weakness, particularly in the lower limbs, caused by a failure of nerve cells to release enough acetylcholine, the chemical messengers that tells muscles to contract. So it is mainly a presynaptic disorder, unlike myasthenia gravis. We all know about myasthenia gravis, but it is a very rare disorder when we talk about LEMS, that is Lambert Eaton Myasthenia syndrome, which also affects the muscle receivers. But LEMS problem is mainly have to deal with the nerve transmitters. So the clinical relevance for this is, for a homeopathic practitioner, is LEMS represents a profound systemic imbalance, often linked to underlying internal pathologies requiring a deep understanding of the patient's constitutional state. So if you try to understand the mechanism of the action, what actually happens inside our body. So it is mainly about the voltage-gated calcium ion channels. We all know that whenever there is a neuromuscular junction, there is we have to release acetylcholine to pass nerve signals. So when acetylcholine is released, it needs a calcium released from the tax before the synapse. So for releasing acetylcholine from the tax, uh, the calcium is voltage-gated calcium ion channels are stimulated, by which the calcium is released and then acetylcholine is secreted and the nerve signal passed. But in this disease, the antibodies are produced against this voltage-gated calcium channel. So it is an autoimmune attack. The body produces antibodies that destroys these calcium channels, and the result is insufficient neurotransmitter release. The signal from the brain never fully reaches the muscle only. So it is a warm-up phenomenon. Interestingly, unlike other types of fatigue, LMES weaknesses may briefly improve after a few seconds of exercise, also called post-tetanic facilitation. This is a key diagnostic clue for practitioners. How we can identify the symptoms, identify the LMES patient. The primary symptom is progressively increasing weakness in the proximal muscles, like shoulders, thighs. Patient often struggles to climb stairs or get out of the chair. Autonomic dysfunction because the signal failure affects the involuntary nervous system too. We can look for dry mouth, constipation, blurred vision, or dry eyes. Also, the reflexes like tendon reflexes, the knees of reflex are usually diminished or absent. Weakness typically starts in the legs, moves upwards towards the arms and face. So if you try to understand the epidemiology and vital statistics, which is very important because it is a very rare disorder. So it is mainly associated with a cancer, paraneoplastic syndrome, which is mainly seen in the old age people, but very rarest conditions. It is found in small adults or small childs also. So the cancer connection or paraneoplastic syndrome, if we talk about this, it is about 50 to 60% of LMES cases are associated with underlying cancer, most commonly small cell lung cancer. In these cases, the immune system creates antibodies to fight the tumor, but those antibodies accidentally attacks the nervous system as well. So it is mostly seen in the older adults. It is not a disease of small children mainly. It is mainly of the adults which are suffering from small cell cancer. But rarely it is found in children also. So it is a non-tumor LMES, can occur at any age, and it's strictly an autoimmune dysfunction. Prognosis is very bad. According to the National Organization for Rare Disorder, early detection of the LMES can often lead to discovery of a small treatable tumor months or years before it would otherwise be found. We all know about Professor Vijay Prasar's predictive homeopathy and Hammer's theory, that is German new medicine. I have just tried to correlate some conflicts with this disease so we can understand ecologically and homeopathically also the patient, what his patient suffers from in this type of diseases. So it is mainly seen as stuck conflict or motor conflict, the feeling of being trapped, pinned down, or powerless to escape. So the biological purpose of this is the body-induced muscle weakness or paralysis as a play-dead reflex. Slowing movement because the psyche perceives that moving or running away is dangerous or impossible. This is the main conflict. Conflict means the patient, what actually patient suffers from. What is the issue? What actually the conflict going on in their mind, due to which this type of pathology is formed in the patient. So now we'll start for the case. We'll try to understand this case and also the disease and how homeopathy actually is able to heal this type of patients. So I would like to show the initial video that parents have sent to me. What was the condition before the treatment? This was the patient. He was not able to move on its own. He was not able to walk. He was not able to move, stand up from the place. And the parents have to lift that child up and make him sit. So this was the condition. So this was the clinical report. The patient in which the voltage-gated calcium ion antibody was high. It was positive. So we'll start for the verbatim of the patient so we can understand very much precisely and clearly what actually patient has narrated and how I just moved forward and take this case to the understanding of the patient and to analyze the case. So he said that I was completely okay once I was playing and came home. Then my legs were found to were paining a lot, and the next day I was feeling feverish. And slowly my muscles started getting weaker, and my walking speed was getting slower day by day. And I asked, then what happened? Then we consulted a neurophysician, and he did RNS report, that is a repetitive nerve stimulation test. Then I detected with the myasthenia gravis, and we consulted many doctors in this Rajkot city, but no one was able to treat this. So we went to Ahmedabad for the treatment, and there they detected the LEMS syndrome. So parents told that initially they gave butyl injections. Initially they detected the GBS, so that they advised for the IVIG injection. So we gave him 10 injections of IVIG according to the weight. But there was no result. It started from the knee weakness, voice got weak, and then generalized weakness. It was a progress. I just asked, just tell me everything you can say about yourself. And then your physical components, as it's already narrated. Tell me about your nature and everything you want to say about you. The result that my nature is like my father. If I'm playing game and I get disturbed, I get very angry. When food is not prepared like I wanted, then also I get too angry at my mother. Then I realized it was wrong. I tell sorry to the mother. Initially, when I was doing exercise and there were no results, then I was hopeless. And I thought that I just don't want to recover only. Nothing is happening. Every treatment I had taken, but there's no relief. It was the angry tone too of the patient. That he was in a despair or hopeless. But then my mother explained to me that exercise is like my exam of life, only that can help me to survive. So now I'm doing regularly exercise. Then I asked, tell me about your nature before your complaint started, because I want to know, I want to understand what actually the patient was actually thinking or perceiving the outer environment, due to which this actually the conflict or issue is registered in that patient. So I just wanted to talk to him about what was actually happening before this complaint started in your life. So I just jumped to that particular topic. The patient said that my nature was so soft also and hard also. If someone talks with me softly, I also talk softly, and some same with the angry tone too. If someone talks with an angry tone or harsh tone, I will talk the same way. I asked, in what type of situations you get angry? Patient said that if I will not eat, then I won't get mobile. So I have to obey the mother. So I just asked, how does it make you feel? Not good, doctor. I get angry. Angry about? If my mom pinched my feet unknowingly, then also I get so angry on her that, can't you see it's my feet? This was a tone actually of the child. Even to that to his mother also. That much abusive or angry he got. And when I was going to play, I run fast for going to the playground. Then that time my mom used to tell me, walk slowly. That also get me angry. And I just used to eat very fast. Then also mom used to tell me, eat slowly, there is no hurry. That thing also makes me angry. So I asked, what makes you angry in that thing? I just want to understand actually what exactly thing which was making him angry. So I asked, what is actually making you angry in that thing? The patient said, I get angry because they don't listen what I say. Okay. Then I asked, what is your response? I used to throw things. I feel so angry that I feel like to throw things away. How does it feels like? I just asked, how does it feels like to you? He said, as if someone is coming to attack me, and I'm sitting like a small cat in front of them. It was something dynamic. So I decided to explore it more. I just asked, just tell me more. He said that I also feel the same when my friends mock me. Describe the experience at that particular moment of time. I just asked. I get scared. I feel like I don't have that much strength to fight back. Okay, a little bit more. Patient said that I just feel like to beat him with a wooden stick. It causes me headache also. And it happens. So I asked, what happens in your mind at that time? It is not at peace. And constant, all these things run in my mind constantly. I try to distract myself, but it dwells in my mind again and again. So when the person going to harm you or attack you at that time, how do you feel? I asked. So patient said, I feel nervous. But if some other people comes with me, then I don't get scared. They become my strength. I get scared when I am alone. How will I able to face the danger alone on my own? I just think, the patient said. So I asked, just describe the experience of being alone. Again, patient said, I get nervous. And I try to escape from there, but I can't run. I try harder to run, but I don't have that much strength. I feel like others are faster than me. Why I can't run fast, doctor? Why I don't have strength? If they can do, why I am not able to do? This was actually the question the patient also feels in his mind. So I again clarified. This was happening before this illness also, because it might be confused with the illness part also. I wanted to know it was happening before the illness. That's why I confirm and clarify. Was it happening before illness? So yeah, patient told that yes, it was since childhood. So that what makes you scared when alone? Actually, what is making you scared? I asked. Actually, patient said, I just nervousness. So I asked, describe experience of being nervous. The patient said, I get angry and nervous both together. It's like a life-threatening attack. Life-threatening was something more, which is not normal or common that people used to talk. So I again explored how life-threatening it is. I get nervous when I walk, patient said. What if I fall and an ankle will bend, leg will fracture? This was a thought. So I asked, do what makes you actually nervous and scared in this situation? The patient said, I feel I will not able to do it alone. I'm not capable of doing it because I feel I don't have that much strength to fight back. I don't have that confidence that I will able to do it. When I'm alone and when someone is there with me, I feel like I'm confident. I also tremble sometimes. I asked, actually, what are you sensitive of? Patient said, to get disturbed. I'm sensitive to get disturbed. It makes me angry. Again, he's actually very angry. I asked, describe getting disturbed. The patient just tried to explain in a way that if I'm doing my work and my mother is calling me to buy something from the market, I get very much angry and disturbed because I have to start it again. And again, I have to give all the efforts from the zero. So I asked them, what will happen? I get angry on the mother because that disturbance will make me feel that I lag behind due to that disturbance. Okay, fine. I got what exactly that area was defining to me. Then I asked shifted to the next area to confirm it. And it is the same pattern in the other areas too. So I asked, what dreams do you get? So then the patient said, I will fail in exams. Sometimes I get the dreams that I will fail in exams and parents will be disappointed. And I feel very nervous in that situation. So I asked, just describe that experience in that dream. I feel very much guilty that I got less marks and I disappointed my parents. I feel like that I'm not capable to pass the exam. Okay, fine. So again, I shifted to the next area. I try to explore other areas too. That is the same pattern is existing because everywhere there is an issue of weakness, lack of confidence, capability, ability. So again, I changed to another area to confirm the situation. It is reflected in the same way too. So I asked, in which areas of life you face difficulty? The patient told, in school, I can't go into the stage. I didn't have the confidence that what to say in front of this much public. Again, the issue of confidence is reflecting in this area. So how does it makes you feel? Again, I asked. Again, the patient told that I feel scared and nervous that I will not able to say properly. So what will happen? I said, the percentage will come low. Okay. So what is the fear mostly about? The patient said, people will laugh at me. It will mock at me. How does it make you feel? Guilty, patient said. So any other areas I asked? Yeah, patient told that a race in the school. When I come last in the race, at that time they used to laugh at me. That makes me angry, but I can't express. I used to suppress it. Then I asked, why so? The patient told that because I used to self-doubt that would I be able to do it again better or not? And again, I got that lack of confidence, self-doubt, and weakness about their own his own self. So I asked the general question, as we all practitioners ask at the end. Tell me something about your nature, because I got the crux. So again, I want to explore and confirm in multiple areas it is the same pattern or not. So I can reach to the particular core pattern and core issues. So he told that my nature is like my father. He does everything for me. He is very much important for me. I asked what makes him so important for you as an individual. So he told that he's like a shield for me. Whenever someone says anything to me, he will say that don't do that to my child. So I asked what actually he provides to you by doing that thing. The patient told support, confidence. In any troublesome situation, he will be there to support me. For example, when I'm walking, I have a fear that I will fall and I will get a fracture. But my father says that I will fall, but I won't let you fall. And this has happened too. I was actually falling, but my father actually grabbed me, he told. So that shield word that he used was something dynamic for me, from which I can again try to get into the core of the patient. It was something different. So I just asked, describe shield for you. Forget about everything in your life. Just shield. What is shield? And the patient told, in any troubles, shield will be the protection for me. It is like a god. Like when I'm gonna uh, fall, that God will save me. That shield will protect me. So I asked, in what way it protects you? I got the idea about the shield. I want to know the process. That what is actually that shield doing to that person or that patient. So in what way it protects you? I asked. The patient said, like when I was driving the Activa first time for learning, my father was sitting behind me as a support. So again, he shifted to his father, and he is actually denoting that father as a support. So he was being my shield to support me, protect me from falling. So again, it was the father was a shield for him. Then I asked about the physical generals that you feel hot more or cold more. The patient said both are intolerable to me. Too warm is also sensitive for me. Too cold is also sensitive for me. So where actually you sweat, I asked. So he told that mostly in the whole head, the nape of the neck, behind the ears. This is the areas I just sweat. And his parents actually told me that he was very weak and fearful. He don't go to washroom alone. He get too scared. He easily get infected frequently. He has a weight loss of 20 to 25 kg after this illness. He was obese actually before, but gradually he lost too much weight, although he eats well. He has the habitual constipation, and also he gets the tonsillitis easily, frequently. In childhood, there's a frequent medications for tonsillitis. Every change of weather makes him feverish. This was the history given by the parents about this patient. So now about the analysis, about the case. So the core issues. The core experience in the whole case, in the every areas I explore, is I'm weak, incapable, and unsafe on my own. I can function only when someone is stronger protects me. The core conflicts the patient, which was running through the case actually, is lack of inner strength. I don't have the strength to fight back. I can't run. Others are faster. Fear of being alone. Alone is equal to danger for him. Nervousness, trembling. There is a need of protection. Shield. Father is actually a shield for him. God-like protection. dependence for confidence on him. Confidence comes only when someone is with him. There's a fear of failure and ridicule, like in exams, stage fear, race, public performance. Anger as a reaction to the helplessness, because he was feeling actually helpless. And the ultimate reaction is anger. Anger when disturbed, mocked, controlled, guilt after the anger, and apologizes to the mother, and feels guilty after the failure. These were the core conflicts the patient was lurking around. So the central sensitivity is being disturbed, interrupted, or forced, remind him of his incapacity. So there is both combination. There is an anger also, and there is a fear also. And both thing is there in the case. So the analysis. So all these symptoms and the presentation, and well, clearly it was reflecting the kingdom of mental kingdom, because as the patient was talking about himself only, there were no issues about that the way that person talks is the problem for me, or someone is the problem for me. That person is the problem for me. I am the victim, or he is doing torture for me. There is no such points are there. Mainly the points are about his own ability, his own capacity, right? So it was actually pointing out towards the mineral kingdom. It was very clear. So why mineral? Talks constantly about the strength and weakness, performance, ability, capacity, comparison. Why can't I do it if others can? There's a fear of failure, exams, mark, percentage. There was security, stability, support, protection, loss of structure. It was all reflecting about security and stability. Because, see, if someone is talking about being disturbed, and again start from the first, so that he's actually wants to go in a steady flow. Because of the disturbance, that steady flow, that stability will get into the turbulence. So actually, he didn't want to get his stability get affected, because once his stability will affect, actually his security also will affect it. For him, for his in this case, stability is very much concerned, because he's actually so very weak. He was considering himself underconfident person, a weak person, incapable person. So if because of these qualities he was already slow, he was already lagging behind from the other people. And if after this whole efforts, again, if he has to do from starting, it is an issue for him. What was the response? Getting angry. There is no issues of competition and aggression towards someone, typically based on the competition or a revengeful type. And if it will be the wrong kingdom, it will show the sensitivity or change or reactivity actually mainly. Right? Here the issue is structural deficiency. So it was clearly a mental case. So the subkingdom I have selected is a calcarea group. Why calcium? Why calcarea? The core feeling of this patient is insecurity. He needs external support to stand, to walk, act. There's a fear of falling, fracture, and collapse. Dependence on the parents, especially father. And why? Father is a support for him. He is actually the shield for him, right? He's obedient, but yet angry. And other things like constipation, easy infections, tonsillitis, obesity, and again, sudden weight loss after the illness. Sweating on the head, nape of the neck, behind the ears, fear for health, injury, and future. This whole actually reflects calcarea group also, the raw four features also, mineral features also. So actually, the calcium state is I'm not strong enough to stand alone in this world. This is the reflection of the every calcarea salt. So early to mid calcium stage, like infant to child level. The key features of this case is childlike dependence. Father is a protector on the shield, fear of independence, fear of being laughed at, needs reassurance constantly, cannot tolerate the disturbance, anger when pushed beyond capacity. This is not a mature mineral stage. This is a developmentally arrested stage, and protection replaces the confidence. So psychologically, actually psychodynamically, This is the understanding about the patient. Mental journals, if we try to understand in this case, is fear of being alone, fear of falling, injury, fracture, fear of failure in exams, which is coming in the dreams, fear of ridicule, mockery, lack of confidence, dependence on support, anger when disturbed, anger from control or authority, anger followed by guilt, suppressed anger cannot express fully. Again, it was the incapacity working behind the suppressed anger. So nervousness and trembling and dwelling on the thoughts that cannot distract the mind. The most peculiar symptom is fear, nervousness, trembling, and avoidance, anger, throwing things and shouting, guilt, apologizing, and also self-blame. It is very important. In all the autoimmune cases which I've seen till date, every autoimmune disorder patient has this core psychological pattern that uh, there is a problem in me only. There will be a my mistake only in this situation. There is always a self-blame which is seen in that person. There's also always a self-doubt in that person, which is seen in all the core every pattern in their life, which I have seen in most of the patient of autoimmune disorders. So mainly everything is on the self anger, self blame, self reproach, self doubts. So how it is actually correlating with the autoimmune is, which I understand from the patients, is that mainly the patient is actually thinking that his self is only the problem. So body perceives is this thing as the body is the problem and we need to destroy that body. So our immunity, which is actually responsible for killing the harmful agents from the outer environment, body perceives that our body is only the harmful for our body. So that's why the self and non-self is actually disturbed, and the immune cells or antibodies actually start attacking the our body healthy body cells. So mainly the patient is feel helpless, that I can fight back, and there's a dependency and shield godlike features this patient talked about. Physically, there's a generalized muscular weakness, fatigue, weight loss despite eating well, habitual constipation, easy infections, tonsillitis on weather change, and feverish on the climate changes, sweating on the head, neck, behind the ears, both heat and cold intolerance. Particulars, if we try to explore that, then leg weakness, very slow walking, voice weakness is there, trembling is there, headache during anger is there, and fear while walking is anticipatory, again, because it's calcaria. If you try to understand the miasm, what was the miasmatic symptoms in this case? Soric elements were fear, insecurity, lack of confidence, functional weaknesses was there, anxiety about future, dreams of failure, and sensitive to environment. It was all soric symptoms which I actually perceived. Psychotic overlay is, if you try to understand, is suppressed anger, chronicity of this case, of this complaint, dependency patterns fixed since childhood, because as we explored the situation of the patient before the illness, so it was since childhood, right? And dependency patterns fixed since childhood, deep-rooted fears were there. So pathology becomes established, which was actually misdiagnosed internally, anemia. It was initially diagnosed with GBS and then myasthenia gravis, and then ultimately the patient reached to the diagnosis about LEMS, which is very rare actually. That's right. The SORA gives the fear and insecurity into the patient. Psychosis fixes into its chronic pattern. But I think there is no syphilitic destruction seen mentally, despite physical neuromuscular disease. Mentally, just I'm talking about. Of course, all the autoimmune disorders are mostly syphilitic, right? But mentally, again, the patient is only one issue was there, that the despair was there initially. But again, when I was talking with him, he's still in the hope. So, sauropsychotic pathology, I just consider this patient is in a sauropsychotic stage at present when I just took the case. The illusion mainly I've seen the core delusion of the patient was, I am weak and incapable, and if I am alone, I will be collapsed or destroyed. Only a stronger person can protect me. The central sensation is threat, helplessness, fear, then anger, and then followed by guilt at last, because he is helpless. So these were the rubrics which I have considered. Mind abusive, insulting children, insult parents too, because he used to shout at the parents very abusively, and he has a delusion that injured of him, because he has a delusion that he will fall up anytime and he can get injured. Also, he has a fear that someone will come and attack to me. So I just took the delusion that delusion injured of him, and one delusion is again from that fragility. I just took the delusion in metaphorically, that delusion imagination thin he is. Of course, he was in a despair in the initial slide. We have seen that because he told that I just don't want to recover now because of this. All these doctors said I just took the treatment and there is no results. I don't want to treat only now. And also impatience. That his mother was telling that eat slowly, runs, walk slowly. So he might be feeling that I have to run fast, and I have to move fast because I'm lagging behind. So there is impatience was there in that patient. And again, if we try to consider the pathology, extremities numbness, insensibility was there. Extremities weakness in joints specifically was there because he was unable to move and also stand up properly. His back is also very much weak, the vertebra, and also knee joints and voice are also weak. And again, as his parents told that he was eating well, then also he's losing weight. Generally, emaciation, appetite good with. So all the rubrics were covered by calcarea iodatum. Again, it was a calcarea salt which we have understand it, but the salt which I would like to prescribe, because the angry calcareas are only two calcareas, calcarea sulf and calcarea iode. And pathologically, if you try to understand, his frequent infections, tonsillitis, that's cophilous affections. If you can consider the lymphatic tissue, lymphatic system, again, autoimmune disorder is we can consider it as a reticular endothelial system disorder because our immune system is involved. So all the lymphatic tissue is a part of the immune system. So from his anger, his weight loss in the pathology, 20 to 25 kg weight loss, it is very huge in a very short duration of time due to illness. It is not that type of illness which will lose the weight actually, if pathologically if we see, because he was eating well and then also losing his flesh. So I just give the only one dose of calcarea iode 200. I just see the improvement after the 200 dose, and so I just switch to the LM potency, because usually I used to prefer LM potency in this cross pathological cases, especially autoimmune disorders. This was the report of the post-treatment. His antibody levels were dropped, and the test was again into the negative, which was positive. It was about 186 when before the starting the treatment, and now after the treatment, it was in just 83. So it was a very huge, miraculous result for this patient and for me too, because it's a very cross pathology, and it is difficult to predict the prognosis of this type of cases to manage. And miraculously, just after 15 days of that one dose of calcarea iode, he was able to move on his own with the help of this walker. And also he told that I was feeling much more confident after this medicine. Confident to walk and I will not fall. And see, his father is not standing behind to hold him. He is working on his own, which shows his confidence has also increased along with the walking. Mentally and physically, both patient is improving. After 2 months of treatment with LM potency, which I prescribed 0/6, miraculously, This was actually the physiotherapy center which he was going, and he attempted without a walker, soul vomiting, walking. He is actually walking without a walker. The child, which was actually not able to move on its own, he started walking with a walker. And after the 2 months of treatment without walker, which was the biggest achievement for their parents, their doctors, and even me. And I will actually say that it is only possible due to the homeopathy. So this was all the case about. I'm very happy that this type of pathological cases were also useful to treat with the homeopathy. And I would like to thank IFPH that they just gave the opportunity to present on this platform. So thank you very much, sir.
Excellent, excellent, Dr. Mohit. Wonderful case presentation. And it's time to interact with the speaker. 15 more minutes to go. Participants can raise their hands or use the chat box to interact with the speaker.
Yes, Dr. Akansha just asked what is the meaning of LM potency. LM potency is actually 50 millisimal potency, which is introduced in 6th edition of Organon by Dr. Hahnemans.
So in this autoimmune disorder, you consider we find out that this autoimmune is considered usually most of the autoimmune complaints will be syphilitic in origin. Means
yes, definitely
staying in the syphilitic manner. But in this case, it is a sauropsychotic case, which you dealt with the sensation and delusion state also to select the simulacrum to hit the bullseye, and you cured the case. And it's a wonderful case.
Yeah, actually, I just considered the miasm as a tubercular miasm, the sauropsychotic pattern which I've seen in the case. Of course, the syphilitic miasm is there in the fundamental miasm if we consider. But the dominant miasm of this patient was a sauropsychotic tubercular one, because the weight actually the patient diminished. The weight of the patient actually diminished like about 20 to 25 kg in a very short duration of time after the illness. It is actually reflecting the iodine part and also the tubercular miasm. And also, I've seen that in many autoimmune disorders, the miasm is actually tubercular miasm too, which is actually overlapping with the syphilitic miasm. So yeah. Yeah, so why I just start with the 0/6 potency. So if we try to understand LM potency and the correspondence of LM potency and decimal potency, whenever we try to prescribe 30 potency, the parallel potency of the LM potency is 0/2, because it is actually clinically verified by Dr. Shankaran sir. And he actually explains that whenever we try to prescribe the centesimal potency and we get the result, we can use the corresponding potencies as LM potency by considering the potential weightage, because the potency when we select the potency of the 200, right, it is a moderate potency. So if we can just try to understand, it is a drug proving concept. So whenever we are proving the drug and it is in 30 centesimal potency, so it will only produce that 30 C potency symptoms. But whenever we are proving the 200 potency drug, it will actually give more symptoms. It will also gives the emotional part too. So whenever we are prescribing 200 potency and it is working, So the corresponding potency is actually 0 by 4 to 0 by 6. So mostly it is 0 by 6 which is used, which is actually gives the same frequency of the centesimal potency every day if you want to repeat. So yeah.
Okay, that's a nice explanation. And can you explain a little bit more about the way how you get into this type of treatment procedure, like what Dr. Rajan Shankaran and Dr. Shekhar Algundi is doing? And can you explain a little bit more how you came to this type of core treatment methods?
Yeah, definitely. Actually, Shankaran sir's and Shekhar sir concept is even Dr. Neerav Shah's concept was the same because Dr. Neerav Shah sir is also a student of Dr. Shankaran sir. So actually, they actually want teach us that we actually have to understand the patient, what actually patient tries to convey in every in first 10 minutes. That we just want to explore. We don't want to treat as a doctor. We just don't have to give the medicine to that patient. We just have to understand what actually the problem with that patient is. And mainly Shekhar Sir actually teach us that just look for the dynamic words the patient is telling. Don't just ask for asking and interrogating the patient. Whenever the patient is actually explaining that, for example, our patient, if we talk about, he actually use the words like an attack, like a shield. So these are the dynamic words that patient actually tells about the vital force actually it is reflecting. It is not a patient, uh, humanly speaking. It is the vital force that is speaking. Thus, we have to understand and pick what is not complete in that sentence, and we have to understand that particular dynamic words and get into the core. So it is a process of getting into the subconscious of the patient's mind from the conscious or conscious way of interaction. The moment the patient start talking the nonsense things which is not relevant to our mind, it should be the aha process. That something is not understandable as a normal common sense of the human being. It is something illogical. The moment the patient uses any illogical words, we actually try to explore much more deeper because for him it is very important. For us, it is not important, but for him, it is very important. So again, the moment we try to go on exploring, because you have seen that I was actually exploring what patient was telling. It was not my word which I have used. I have just asked the question about the word which used by the patient. So I just go on try to understand about patient as an individual, and then these core patterns and core issues that what actually is the issue of that person. If you talk about the mineral, somewhere mineral feels that something is lacking in that in me, and something is not complete within me. I am incapable of something. It means something is completing that patient, which he is not talking about. So I will just try to ask what actually completes that person due to which he is now feeling incomplete. If plant, if you see plant type personalities, that plant is sensitive about certain things, so there must be there a reactivity. That some if they are sensitive to something, there must be a reaction to that particular thing. There must be an opposite. In animals, if the patient talks as a predator, then there will always be a prey in his story. If the patient is a victim of prey, then there will always be a predator in his or her story. So there is always a sensation and function. As we see in the ninth aphorism, that vital force actually reflects by the sensations and functions. So there is an imbalance in that sensation and function, which is actually reflected by different personalities of plants, minerals, and animals. So we just have to find out what is the imbalance, where is the imbalance, how is the imbalance, and in what way that person perceives. So this is the only process. It is very much simple. It is not at all a very rocket science. It is just understanding of the patient. That's it.
That's also great. And usually, while studying the initial stepping stones of homeopathy, the classical homeopathy, every
Yes.
drugs are being proved and being recorded. And when a person is there with their presenting complaints, a homeopath should listen about the presenting complaints and diagnose the case. And after that, we need to find out which similar medicines are, which is the very similar he is in. And for that, the totality of symptoms is being collected. And in this type of case taking, the totality of symptoms, we are not, I afraid to say that we are not giving more importance to the totality of symptoms, but the delusion and sensation, or we are just going before the symptoms of these rare peculiars, these illogical things which you said, very much personal to the person, per patient itself. So I think it is a bit time consuming also. If a practitioner is very busy and if he is going to see a lot of persons in his clinic in a very limited time itself, if there is a rush going on, and if a lot of persons or patients are waiting, is it possible to do this type of treatment in a fast manner?
Yeah, definitely, it is very much possible. If we take the example of our legendary Dr. Sarkar sir, he used to just prescribe within 2 or 3 symptoms by seeing the patient and observing the patient. So it is all about the in what angle we are seeing and what angle we are taking the case. But I've chosen this way of seeing the patient and treating the patient because I believe in healing a person. I believe in understanding a person. Why it is important and why actually I consider it as an important thing. Even I feel that thing which you have said, which is actually right. Practically it is very right that you ask that if we are focusing on this illogical things and we are consuming, it is very time consuming thing, because if we are going deeper in every case, it is very difficult for us to see the more patients in one day. That is completely true, I agree on this. But my purpose is to understand the patient in a deeper way. Why? Because in our homeopathy is it is only a science that considers mind and body together. Why it is important? Because everything, if we try to understand it, is first registered in our mind. If we try to understand in any event for any patient, if that event is affecting that patient, it actually registered in three places simultaneously: brain, mind, and body. So if we try to understand how the patient perceived in that situation, what actually he experienced, what actually he see that in that particular situation, so that the brain gives the message to the body, the same message that body also get what mind perceives. So I just wanted to understand about the psych psychodynamics of that patient, that why this patient has been suffered from this disease and what actually he perceives. Because if we try to understand by questioning that patient, so during this conversation also, patient also get aware. So again, if this case would have taken by Sakar sir, it would be a 5 minutes case, right? So it is just about the different angles to see the case. We can go for any way we can, which is suitable for us as an individual.
Okay, that's great. And on the fact level, from the fact level or the presenting symptoms or the common symptoms of the particular symptoms of the case, we are going
Right.
much far beyond to that sensation delusion level, and we are going to we need to prescribe for the person itself. And we are dealing this is a great homeopathy, and because in various parts of our place in our country itself, homeopathy is being practiced with mix of means lot of medicines to fix
Definitely.
single symptoms or something, and it's very bad to see these things also. Though we are getting some results, some palliative steps will be we will get that from that. And this type of homeopathy is also very excellent. We need to get we need to familiarize with this thing. It's not easy thing.
Definitely, sir. Definitely. But the purpose behind is to heal the person, because see, patient is treated everywhere, even different homeopaths, even different allopaths, even different other mode of science. So it is not about treating the patient. It is about understand the patient and heal that person from that state. So it is very important to understand in this way. It actually helps the patient when we are actually asking this case, in this manner. Patient also gets aware about his own issues. That is very important for me.
And thank you. So this is precision homeopathy, I will say. And
Yeah, definitely.
so glad that we got some other classes also on the lineage of this Dr. Shekhar Algundi and Dr. Arvind Shankaran. We are so glad, and just
Thank you,
had
sir.
another very brilliant class from you, Doctor. And on
Thank you
behalf
so
of
much.
IPH, I thank you for this. And I expect more sessions from you in the near future itself. And
Sure, sir.
can you add a little bit more about you and your practice and all? You can say a little bit more how to conduct you, how to get acquaintance in this type of treatment, means how to study more about this type of thing in the higher learning of homeopathy. Can you share?
Yeah, definitely, sir. I would actually love to share, because, and especially all the youth, I want to give the message that students actually in the college life, they feel that homeopathy is very hard to practice. Homeopathy is very it's not my cup of tea, and it is placebo science, or it is completely philosophical. So it is all about dedication. It is all about patience. It is all about urge to learn something. Specifically in the youth, I want to convey the message by presenting this gross pathological case, that it is possible that you can also treat younger than me. Also, you can treat in this type of cases if you just try to understand this case, or understand the patient, and not to prescribe the medicine, and not to earn. The focus should not to earn from the our practice. The focus should not to prescribe the medicine. Our focus should not only just to treat the patient. Our focus should be try to understand the patient, and also to heal a patient. And if I tell about my practice, I actually represent my gurus, Dr. Shankaran sir, Dr. Shekhar Algundi sir, and Dr. Neerav Shah sir. They are my gurus, and I just suggest every student or every beginner practitioner that a mentor is always necessary to learn homeopathy. Even though we read books, even though we have attended many seminars and webinars, a mentor is always necessary, from which we can learn consistently 1, 2, or 3 years, to understand, to see live cases, to get the live experience that how things goes. And I'm not actually representing any type of methods here, any sensation method, or any type of other different depths of method, because ultimately it is homeopathy. It is a synergy. That's why Shankaran sir has used the word synergy approach. It is not a different syndicate groups of homeopathy. It is just a synergy. Every homeopath has its own way of understanding things. Everyone has their own vision. Ultimately, every homeopath has a purpose of healing a patient, treating a patient, and use homeopathy in a best way they can to uh, serve the community. So yes, there is no such thing like a method. It is just a different way of seeing the patients, different way to see homeopathy concepts, and to learn the concepts of the legends and our stalwarts. So I have learned predictive homeopathy also. I have learned sensation homeopathy also. I have learned Segal's method also. I have also inspired by Dr. Sarkar sir's method. Also, I have got into touch with George Vithalkar's method. I've learned every method, even ICR method, right? And I use in my practice all these methods when we need it. So actually, patients decides what type of method we have to actually go for. Sometimes it is difficult to reach to this type of sensations and delusions, because people always does not open up, right? So it is not a fixed criteria in homeopathy. Our goal is to understand an individual as an individual person. Our goal is to be unprejudiced into treatment, into prescribing, and our goal is to heal that heal that person. That's it. Nothing else. This purpose will take you further. That's it. Nothing else.
Thank you, Doctor. And we expect you more to be here with various other sessions also. And I thank you all for attending the session. And it's time to start the Malayalam session, and over to Dr. Mariama John for the Malayalam session. Thank you.
Thank you, sir. Thank you, sir. Thank you, sir.